This is our client, Asha Adani Mitra Anand. She was born on 29th of June 2001. She is a player of handball. She educated in UiTM Pahang in Bachelor of Office System. She had an injury at the same knee, which is ACL, in 2017, 2019, and also 2022. And she got a plus with the meniscus and also the MPFL. The cause of injury is first she played handball, and also she fell from the horse when she riding it.
Now, I would like to do the introduction for gait analysis. So, gait is someone's walking pattern where we could identify whether that person has injuries which lead them on having an abnormal walking pattern. This is because if the person did sustain prior injuries that affects their brain, spinal cords, or leg, it could lead to the changes in their walking. So this analysis could be done by asking the client to run or simply watching them walking. So the best moment to observe their walking pattern is when they enter the room for analysis. This is because that is their truly walking style rather than when we ask them to walk. So most of them would likely to pretend that they have a good walk. So that will make the data that we collect not really accurate. There are two types of gait analysis, which is the first one is through observation or manually, and the second one is through data analyzing using technology. For example, using computerized video cameras in order to watch the movements in slow motion, or using electrodes in order to watch the muscle movement, and many more. So in this slide, I would like to explain about the gait cycle of our client. So gait cycle explains the cyclic pattern of movement that occurs while walking. There are 8 phases of gait cycle, which could be divided into 2 sections, which is the stance and the swing. So the first is the heel strike. So here is the initial concept of the movement that use around 3% of the gait cycle, and in this stage, our client did not state any pain. Next is the foot flat. So here our client used up to 10% of a gait cycle, where she would transfer her body weight onto her dominant leg, and it will end once her contralateral foot lifts off the ground. After that is the mid stand, where our client used up to 30% of her gait cycle in this stage. So the mid stand is the moment her toe off point to the first point of her heel move from the ground. Next, heel off, also known as terminal stand, that occurs when the heel is being lifted off the ground in order to move forward. And at this stage, our client used up to 50% of her gait cycle. Then is the final stage of stance, which is the toe off, where the client will push her toe into the ground and move another leg forward. So in this stage, our client used around 60% of her gait cycle. Next is the early swing, when the foot is being lifted off the ground with the knee bent and ankle in dorsiflexion. So here our client used around 70% of her gait cycle. Next is the second swing phase, which is the mid swing, where the non-dominant leg will pass through the lead or dominant leg in order for the body to move forward. So here our client used around 85% of her gait cycle, and in this state she did stated that she feels slightly pain. Last but not least, deceleration, or also known as the leg swing, where the foot moves in front of the body with knee extended that makes the movement decelerate. So the lower limbs now are getting ready for the next heel strike. And then in this stage, our client used 100% of a gait cycle. Now, for this slide, I would like to explain on the definition of osteoarthritis. So, osteoarthritis is the most common arthritis that could happen, usually in the hands, hips, and knees. So, it could also be known or also be called as the degenerative joint disease or wear and tear arthritis. This disease would usually occur when the protective cartilage, which is located at the end of our bone that function as a cushion in order to absorb the shock, wears down over time. So usually it could be due to the age factor, but sometimes it could also be due to another factor, which is injuries. There are also two types of osteoarthritis, which is the first one is the primary osteoarthritis that happen without any reason, such as due to the genetic factor or also environmental. And the second is secondary osteoarthritis that happen due to the injuries, disease, or any infection.
Okay, thank you. Now I would like to continue with my slide, which is component the osteoarthritis. Based on my slide, it is commonly known as a wear and tear condition. Osteoarthritis is one type of arthritis that exclusively affects at our joints, commonly at our hands, neck, hips, knees, and also at our back. This osteoarthritis is one type of the injury that causes you has a degenerative joint tissue and the end progression loss of articular cartilage. Okay, second is cartilage breaks down and becomes harsh. Why? Because at the ends of the bones in a healthy adult, they are coated with a joint. There has a smooth and slippery substance that called cartilage. This substance that called cartilage that allows us to glide or to make movement to become effortlessly. For example, when you're doing the hand movement like this articular cartilage also means also plays their role in our movement like this. Okay, because this when the cartilage is gone, the bones rub together, so there has no tissue, so it will cause you a pain. So this bone cause a bone spurs or lumps of excess bone and can form in a joint region. So lastly, osteoarthritis is the fourth leading injury that cause disability in the world.
This is the heading of the subnote. The documentation under this heading comes from the subjective, which is the experience, personal view, or the feeling of a patient or someone close to them. The first one is the site of injury. The knee osteoarthritis specifically refers to the degeneration of cartilage in the knee joints. It is the one of the most common forms of osteoarthritis that can cause the significant pain and disability. The symptoms of the knee osteoarthritis may include the pain, the stiffness, the swelling, and difficulty to walking. The risk factor for developing the osteoarthritis, including the age, obesity, previous knee injury, and repetitive stress on the knee. Next is the mechanism of the injury. She had a grade 2 of injury, which is in this stage, there is a mid joint, space narrowing, and possible bone spurs that forming around the edges of the joint. Next is the previous of injury. She had four injuries before, which is the ACL in 2017, MPFL, and also the meniscus on 2019, and also the MPFL, the meniscus, and ACL on the left knee, which is on 2022, and the newest is the osteoarthritis on 2023. The next one is the sign and the symptom of the knee osteoarthritis. The first one is the sign, which is a swelling on the knee. The next one is hard to do a flexion movement to do a full range of motion. Next, the symptom, which is she fell in front of the knee, discomfort, and also the pain. And also, she had a popping sound, which is the patella dislocation at the knee. The objective part of the note is the section, where the result of the test and measure performed and the therapist's objective observation of the knee are recorded. Objective data are the measurable, the piece of information used to formulate the plan of care. Good tests and measures that produce objective data are also repeatable, valid, and also reliable for the client. There are four observations that have been done, which is first is postural alignment, second is ROM, which is range of motion, third one is the palpation, and the fourth one is the special test. The first one is postural alignment. This is observation on how she's standing, walking, and stabilize herself with the injured knee. It can show the difference between the healthy and also the injured knee. The next one is range of motion, which is the movement of injury part will be seen by her difficulty to move and cannot to fully extend her leg without help. Next one is palpation, which is we do the physical examination by touch her knee area to feel, see, and locate the difference between the knee to improve her RM. And also the next one is special test, which is special test can be done by X-ray, MRI, and physical examination like palpation, range of motion test to see how far the injury happened.
Okay, thank you, Ismo. Now I would like to continue with the assessment. So there has two goals, which is short-term goals and long-term goals. On the short-term goals, based on the slide, we want to focus so it could decrease the Aisha Adani pain and decrease her inflammation. It is because Aisha Adani got diagnosed with the left knee osteoarthritis on 10 May 2023. So based on her verification illness from her doctor, she is not undergoing surgery. However, every Friday she need to go to the UIA to seek the physiotherapy to perform a cycling and hydrotherapy treatment. This is because Aisha Adani she has a injury history, which means before this she had made a ACL reconstruction and meniscus surgery. So she still have to undergo the rehabilitation program. Okay, because we want to focus on to decrease pain and inflammation, so we recommend her to do exercise that land-based exercise, LBE exercise, and we want her to avoid the plyometric exercise or any exercise that has the bouncing movement, because we don't want to stress her knees. Then other than that, we also add aquatic exercise and also walking and stationary bike, as it good for her, so he will not overuse the pressure on her knees. Okay, next, for her long-term goal, we focus more to improve her mobility and function, and also we told her that she could gain she could delay the progression of the osteoarthritis from it become worse. So during this, she could do the functional daily activities without feeling pressure or any discomfort on her knees. Although there has no medication that can cure the osteoarthritis completely, however, she can do exercise such as aquatic exercise or land-based exercise that has no bouncing movement, so she could delay the progress for her osteoarthritis to become worse. Other than that, she also has to monitor her weight, because weight balance will provide more stable on her knees and will reduce the pressure on her knees. Okay, now the recommendation exercise. I have picked 5 of the recommendation exercise for Aisha Adani. Actually, there has more, but I just pick a few as an example to tell. Okay, first, I picked the land-based exercise because the land-based exercise is suitable for Aisha Adani, because she could not do a movement or exercise that involved with a bouncy movement such as plyometric exercise, because it already will give her knees pressure. Also, I already confirmed with her doctor that she cannot do the exercise that has a bounce movement. Okay, the first exercise I picked for her is the knee raise. Okay, how to perform? First, you have to sit with lock your back, chest up, strengthen your back. Then you have to lift your knee, okay, your arm, your hands is below on your hamstring, then you need to pull up your hamstring as high as you can. But ensure when you do this, you have to lock your back. Okay, then slowly to a starting position. Okay, next is walking. Even though it is a simple exercise, but it gives influence for Aisha Adani because she has the osteoarthritis. The instruction first is you need to keep your heads up, okay, and strengthen your back. Then put step 1 forward and swing your arm, okay, with your back. Your body posture must be straight, okay. Then after you step forward, then take a step another forward with your arm swing. Okay, so we want to give the Aisha Adani a little bit complicated, so we ask her to do 20 repetition forward and 20 repetition walk backward. Okay, the last LBE exercise is back kicks. However, we ask her to do a back kicks without a bouncy movement. So first she has to stand up straight, and then she need to lift her foot up and ensure and try to make contact with her glutes. Okay, we just ask her. If she cannot do, then it's okay. But we just ask her to do it, so she will feel the tension at her quadriceps. Then after that, she has to switch leg to repeat the motion again. This is aquatic exercise. It is really recommend for her. Even her doctor also recommend Aisha Adani to do more on a aquatic exercise, because even though she make a bouncy exercise, it's not give her knee a pressure too much that can cause her a pain. Okay, the first aquatic exercise I pick is side stepping. So the instruction, first she just needs to stand with her knees slightly bent. So then she have to take a step aside. So this exercise is really good for her because when she doing it in the water, it will give her control and it will not pressure too much on her knees. Another aquatic exercise is the hip kickers. First, she has to stand straight. Then she need to kick the left leg forward with the ensure to keep her body posture is straight, lock back, chest up, and then she has to kick with her right leg forward. When she kick the left leg forward, her hands need to touch her hips. Okay. Then she needs to repeat the movement about 20 repetitions. Okay, thank you. That's all from my slide. Then I will pass to Aisha for her to conclude our presentation.
In conclusion, by knowing gait analysis or getting gait analysis, a person could reach out to the doctor as soon as possible in order to get the treatment if they are having gait problems. For example, surgery, taking medications, having physical therapy, or using mobility devices. So, here it is very important for us to always be aware about our body, especially walking style, because we will never know how much an injury could affect our daily life. So that's all from us. Thank you so much.